This is a presentation on the Athletic and Rehabilitation Therapy Program. The entry points for the Athletic and Rehabilitation Therapy at AIT were at the level of 430 in 2020. The entry requirements for the course are a minimum of grade H5 at a higher level in 2 subjects, plus a minimum of grade 06 or H7 at ordinary level in 4 other subjects in the Living Certificate examination. Mathematics and English or Irish language are the mandatory 2 out of the 6 subjects. There is an alternative route for anyone with a major QQI award holding 3 distinctions and a pass in one of the mathematics components, or a Living Certificate Maths at 06 or H7 level. These places, however, are limited. The Athletic and Rehabilitation Therapy course consists of 5 main strands that are explored throughout the 4 years of the program. The 5 strands are anatomy, rehabilitation, psychology and nutrition, and professional skills. There is a series of modules delivered across the program to explore the anatomy of human body. The main modules focusing on this area are human physiology, anatomy of the lower and upper quadrant, anatomy of the head, spine, thorax, and abdomen, diagnostic imaging, medical conditions in sport, and introduction to biomechanics. All of these modules are tailored to equip the students with the knowledge of human body that they will need as future athletic and rehabilitation therapists. The main focus of this strand is on musculoskeletal and functional anatomy of the human body. The rehabilitation strand consists of fundamental rehabilitation skills, fitness injury prevention, injuries and therapies modules, advanced sports therapies, orthotics and strapping, advanced sports nutrition, rehabilitation and return to competition, performance testing in sports and exercise science, and strength and conditioning module. On completion of these modules, students gain knowledge and become competent in clinical skills, allowing them to manage musculoskeletal injuries. Those skills include, but are not limited to, injury prevention strategies, diagnostic skills, treatment techniques, and rehabilitation planning skills. There are 3 psychology and 3 nutrition-related modules delivered within the program. The knowledge and skills gained on completion of these modules add to the skill set of students as future medical professionals, equipping them in basic motivational and counseling skills, together with ability to provide a basic nutritional advice. These modules are Introduction to Sports and Exercise Psychology, Sports and Exercise Psychology, Psychology of Sports Injuries and Rehabilitation, and also Cell Biology, Drugs in Sport, and Sports Nutrition. The students' professional skills are attained on completion of the final series of modules, including maths for sports and health, introduction to athletic and rehabilitation therapy, marketing and applied entrepreneurship, evidence-based learning, legal and ethical issues, research methods in sports and health sciences, and a research project module. Labs and practical classes are inseparable part of learning at AAT. Within the Athletic and Rehabilitation Therapy program, laboratory-based classes are delivered in all core science modules. However, small hands-on practical classes also run, and they facilitate development of expertise in injury prevention, treatment, and rehabilitation. Considering the practical nature of this program, the applied classes in the area of patient assessment and treatment are delivered in a form of student-led clinics. For a purpose of this applied learning, START Clinic was created, and within this space, athletic and rehabilitation therapy students get to practice their clinical skills under supervision of certified athletic therapists and chartered physiotherapists. In addition to student-led clinic, students take part in work placement alongside either AIT or local sports teams. This operates on an ongoing basis throughout 4 semesters and starts in second semester of year 2. With this early placement exposure, students can practice the clinically relevant skills as they learn with the real-life patients. To supplement the experience gained in the first 2 years of college, our students take up a full semester-long final year work placement. This placement takes place in the first semester of year 4, and it allows students a full-time exposure to a life of athletic and rehabilitation therapists. The workload of this placement is 420 hours minimum, with a mixture of work in both clinical and pitch site settings. On average, this placement lasts around 24 weeks, depending on students' weekly schedule. The placements that students can choose from are located across Ireland and also abroad in the United States, Spain, and Portugal. The Athletic and Rehabilitation Therapy course is an honors bachelor degree accredited by Athletic and Rehabilitation Therapy Ireland and also by World Federation of Athletic Training and Therapy. As a part of this program, students become certified in emergency first response, and on completion of the 4 years, they're eligible to take an RT exam and become certified athletic therapists. For those who are not interested in a career of certified athletic therapists, there are other options. Graduates of this course can progress to master-level programs in the areas of physiotherapy, strength and conditioning, nutrition, sports performance, or physiology. They can also look into postgraduate research opportunities at both master's and PhD level, or take up a research assistant or project manager roles. Athletic and Rehabilitation Therapy is one of 5 programs within the Department of Sport and Health Sciences that is proud of its team-focused and positive motivational ethos, together with gender equality embedded in teaching, learning, and research. Progressive, engaged, and informed teaching is delivered by specialists in the area, doctoral-level staff, certified athletic therapists, and chartered physiotherapists who research and are also engaged in community and industry. As part of recently created SHE Research Group, the staff and 15 PhD students work together to bridge the gender data gap in sports, health, and exercise research. Athletic and rehabilitation therapy students have access to state-of-art teaching and learning facilities like sports science lab, biomechanics lab, health science lab, therapy rooms, high-performance gym, international arena, and science labs. To finish off, please read through some of the most recent feedback received from our current students. Thank you for your attention.